హలో గైస్, వెల్కమ్ టు Examdays. ఈరోజు మనం ఈ వీడియోలో డిస్కస్ చేయబోతున్నాం MLHP Entrance Examination Bits, video number 7 out of 100 videos. This is the series for the only for MLHP Entrance Examinations. So today is the first question. Medical asepsis differ from surgical asepsis in that is aimed at your options: A, sterilizing all equipments; B, preventing entry of microorganism into the body; C, killing all microorganism; D, preventing transmission of microorganisms. The correct answer is going to be option D, preventing transmission of microorganisms. So the explanation is going to be, this is the image as given only for the user understanding purpose, because the medical asepsis differ from the surgical asepsis in that it is aimed at preventing the transmission of the microorganisms. So this is the one is the victim, and this is the supposed to another victim, and so this all the microorganisms will be transmitted one hand to other hand when it is going to be touched. Okay, so what are the going to precautions? So what are the precautions has been takes place here? We have to use the keep immunizing up to the date, wash your hands often, prepare and handle the food carefully. So some other precautions has been given here. Moving to the next question. To properly stage a pressure ulcer is a, your options: the skin must be completely dry; B, the patient must be supine; C, natural light must be used; and the option D is going to be a share must be removed. The correct answer, option C, natural light must be used to properly stage the pressure ulcer. Okay, this is the skin, actually this is the normal skin, any human skin, and this is the ulcer as been takes place inside the body, which state that stage 1 ulcer have not be broken through the skin's. Stage 2, it was breaking into the up to the 2 layers, but stage 3 will be affect to the with the top of the 2 layers of the skin as well as the fatty tissue. So final stage, which is called as the 4th stage, ulcer and the deep wounds that may impact muscles, tendons, ligaments and the bone. So this is the mainly used. So natural must be used in order to stage the pressure the ulcer. Moving on to the next question. Gestational diabetes increases risk for the following except. Gestational diabetes increases risk for the following except: A, microsomia; B, prematurity and stillbirth; C, congenital anomalies; D, small for dead fetus. The correct answer is going to be small for dead fetus. So this is not a diabetes risk. So as you see in the image as given, the fundal height, the top uterus and the pubic bone. So this is the difference, the length of this difference is given here, fundal height. Okay, so here is the uterus and this is the placenta as given this clearly saw that image. So it's stating that the small for gestational age is a term of used to describe the baby who is smaller than the usual amount of the number of weeks of pregnancy. So SGA babies usually have the birth weight below a 10th percentile for the baby of the same gestational age. Moving on to the next question. In what ways cloud hepatitis, a virus be spread in a if one of the kitchen employees in the reservoir? So this is the kind of questions as given. When you speak into the questions, we have 4 options. It's going to be option A, while he speaks and sneezes through droplet route; B, while he coughs out through airborne route; C, if he sustains a cut through bloodborne; and the D, oral fecal route through his hands. So that's going to be correct answer is going to be oral fecal route through his hands. So you can see that this is the image actually how the virus is going to be transmitted. Okay, the disease that can be spread in the fecal oral route that can be transmitted from the person to person in a food or in a water. So this can be happen when the person is fails to wash their hands properly after using the bathrooms. So this is the main cause as given here. Okay, so moving on to the next question. The amount of air passing into out of the lungs during the each cycle of breathing is referred as a, once again question, the amount of air passing into and out of the lung during the each cycle of a breathing is referred as a residual volume, B total lung capacity, C tidal volume, and the D vital capacity. So the answer is going to be tidal volume. So here is actually given the tidal volume is essentially every breath the person has takes is one of the main determine the minus ventilations, evolution ventilations. Minutes ventilation is also known as total ventilations. Okay, this is a measurement of amount of the air that can enter into the lungs per minute. So it is a protect that respiratory rate and the tidal volume. So here is given this image only for the reference purpose. How is every breath has been takes place. Every breath the person is the takes. Moving on to the next question. The characteristics of Logia rubra is a. The characteristics of Logia rubra is a bloody with fleshy odor, B foul odor, C pink brown with flesh odor, D yellow white. The correct answer is going to be option A, the bloody with fleshy odor. So the metallic smell is typically caused by the presence of iron in your blood. This smell is most common and is not normally cause other concern. Okay, so some women have the reported experiencing is almost a sweet smell coming from their period blood. So the coping with Logia as given the images so that you can understand how it's going to be showing. Okay, so you have to take the precautions like use the sanitary pads, wear the comfortable cloth, and take an easy as possible. Take some rest, okay, body rest, and also try disposable diapers, okay, and avoid the penetrative sexual intercourse here. Okay, so these are the precautions will be taken during the period. Moving on to the next question. The main cause of genital warts. The warts is a chemical we call as condylomata acuminata. So this is the chemical idiom. So but formally we call as the main cause of the genital warts is what? A Neisseria gonorrhea, B herpes simple virus, C human papillomavirus, D pelvic inflammatory disease. So for the words we can see that the answer is going to be HPV, which is a human papillomavirus. Yes, human papillomavirus is the most common sexually transmitted infection, which is called as we call as a STI. So we don't know STD, which is nothing but the sexually transmitted disease. At the same case here also, these warts actually is going to be transmitted through STI. Many people without HPV don't develop any symptoms, but they can still infect other the sexual contact. Symptoms may be included the warts on the genital or the surrounding skins. So there is no cure for the viruses, and the warts may go away with their own. Treatment focus on the removing the warts. A vaccine that will prevent the HPV strains most likely causes the genital warts or the cervical cancer is recommended for the boys and girls. So here is these are the warts on the hand, which shows that is the cause of the family or some STI disease. Okay, these are the warts actually is going to be removed, or it may prevent with a kind of vaccination. Okay, so this is the regarding human papillomaviruses regarding the warts. Moving on to the next question. The major determinants of health is what? The major determinants of health is what? Option A, public education and information, C. screening for the disease, C. agriculture, food and nutrition, D. public works, sanitation and housing. So this is the main causing one of the major answer for the determine the health. So screening the disease. Screening includes methods, technique, procedure, examination for the early detection, unrecognized disease or defect apparently healthy persons. So the screening program may be test the people for the disease or the condition before they have any symptoms of the disease. Moving on to the next question. The reflex action of the toys are indicative of abnormal disease. So the reflex action of the toes are indicative of abnormalities in the motor control pathways leading for cerebral cortex is a what? Your options: Achilles reflex, B. Babinski reflex, C. Patellar reflex, and the D. Romberg test. The correct answer is going to be Babinski reflex. So here is the image has been is given for the reference. So this is the actually the test using some instrument to test this path as is clearly mentioned. So this is a negative side and this is the positive side is going to be C. So the adult or children over the 2 years old, the positive Babinski sign happens whether the big toy bend up and back to the top of the foot. So other toy is a fan out. So this can be means that you may have the underlying nervous system or the brain condition that may causing your reflexes to react abnormally. So this is the case will be happen in the Babinski reflex process. Next question. The sky instruction to be given to the patient and the caregiver with a epilepsy is as follows: except A. take shower in the bath tubes, B. maintain the medication and seizure shot, T. take medications daily, D. avoid alcohol, smoking and hypoglycemia. The correct answer is going to be take shower in the bathtub, which is not included in the instruction. The sky instruction is given to the patient. Moving on to the next question. The brain region which is responsible for coordination of voluntary muscular movement, posture and the balance. This is going to be your options. Is the spinal cord, B. cerebral cortex, C. medulla oblongata and C. cerebellum. The correct answer is going to be option D. cerebellum. Okay, so we can say cerebellum is the correct answer. It's going to be possible in the brain where it's going clearly shown here. Okay, this is the spinal cord is a major spinal. So here is the present here. This is the structure that located at the back of the brain and underlying the occipital and temporal lobes of the cerebral cortex. So the image is given here. Although this cerebellum accounts for approximately 10% of the brain volume, so it contains over the 50% of total volume of the total number of neurons in the brain system. Phototherapy is indicated for children with A. hemolytic disease, B. hyperbilirubinemia, C. necrotizing enterocolitis, and D. hypoglycemia. The correct answer is going to be hyperbilirubinemia is the correct answer. It is a condition in which there is a buildup of bilirubin in the blood causing yellow discolorization of the eyes and skin, which is called as jaundice. Moving on to the next question. The Erikson theory. In Erikson theory, adolescents develop a sense of A. initiative, B. Industry, C. Intellect, D. Identity. The correct answer is going to be option D, identity. During the adolescence, children explore their independence and develop a sense of their self. So those who receive the proper encouragement and reinforcement through the personal explorations will emerge from the stage with a strong sense which we call as a self and feelings of independence and the control. So this image is clearly stated how is going to be increase the psychological development for each stage of the children. Example for autosomal recessive inheritance. Example for autosomal recessive inheritance is what? Your options: hemophilia, B. Cystic fibrosis, D. Craniofacial disorders, and D. Skeletal disorders. Correct answer B is going to be cystic fibrosis. Cystic fibrosis is a disorder that damages your lungs as well as the digestion tract and other organisms. Considering the chain of infection, is reservoir must be what? Your options: Staphylococcus bacteria, B. A contaminated water supply, C. A tick carrying Lyme disease, and D. Uninfected patient. Correct answer is going to be a contaminated water supply. So this question is going to be the considering that the chain of infection is a reservoir must be have the contaminated water supply. Moving on to the next question. A clinical sign that a patient is a close death would be A. The periods of apnea and irregular respiration, B. A pain that is well controlled with a small doses of morphine, and the C. Increasing BP upper respiration, D. Nausea that occurs after a meals. The correct answer is going to be option A. The periods of irregular respirations. So the word respiration pattern as given, so which is characterized by the regular deep respiration interpreted with periods of apnea. So these are the question, guys, today. So almost we have discussed all the important bits in this video, and you can use the description link. There is a link for the this sheet PDF. You can download this PDF and you can prepare as well with self-study. Okay, and don't forget to like the video and share the video and subscribe for the Examdays TSAP YouTube channel. Okay, download this PDF. Use the link is available on the description box. Thank you so much. And if you have any topics regarding MLHP or CHO post, just comment on the below and we will discuss with the topics as requested by the user. Okay, so don't forget to subscribe Examdays. Thank you.